Hello and welcome. I'm Ahmed Al-Salihi and you're watching Dr. Sugar. This video will be the first of a series of videos in which I'll discuss exam strategies for the MRCP PACES exam. We'll discuss 7 vital points that, if you pay attention to, will improve your overall performance in the MRCP UK PACES exam. Number 1. What's the aim of the exam? The exam is designed to be the final step in your preparation to become a medical registrar. And what it means to become a medical registrar in the UK training system is to be a doctor who's able to practice medicine at a senior level, who is also safe and is ready to apply for subspecialty training in one of the medical subspecialties. So what it really means is that it is a convoluted way to interview you for a medical registrar job. They would like you to demonstrate for them that you can manage medical emergencies and acute medical problems efficiently and safely. They also expect you to be able to demonstrate for them that you have deep knowledge of common medical problems while you have basic knowledge of less common or rare medical conditions. The exam is also designed to test your character, your ability to manage time, to lead, and to work within a team. Therefore, to become a medical registrar, it really means to be a doctor who has very good medical knowledge, is capable of leading a team and manage his time efficiently, and is someone who has enough knowledge about different medical problems so that he or she is ready to apply for subspecialty training. This brings me to our second point, and that is to get inside your examiner's head and to learn how an examiner thinks. A typical examiner will not let you pass the test if you're unable to demonstrate that you have in-depth knowledge of some of the most common medical problems, while they will be lenient if you don't know everything about the rarer ones. Let me give you an example. If the patient has heart failure, the examiner expects you to know everything there is to know about heart failure. But if the patient presented with arrhythmias and at the end of the consultation they ask you a few questions about arrhythmias and they ask you about some rare arrhythmogenic disorder and you aren't able to name it, or you aren't able to tell which gene causes the problem, you will still pass as long as you've answered the more important questions. But if they ask you which medications improve survival in heart failure and you're unable to answer that question, then I'm afraid it will be very difficult for them to allow you to pass. The third point is to learn about the structure of the NHS and how patients are looked after within an NHS hospital if you don't already work in the UK. Medical care provided to patients in the NHS by a medical team. The team is not only a doctor and a nurse. You have occupational health therapists, you've got physiotherapists, you've got speech and language therapists, you've got dietitians, you've got specialist nurses in literally every different specialty there is. Say for example you get a patient with COPD and they ask you how would you manage this patient. It will not suffice if you enumerate the medical treatments or even the lines of treatment if you do not mention the patient may need chest physiotherapy provided by the physiotherapists, or a review, say, by the respiratory specialist nurses if the patient's being considered for long-term oxygen therapy at home, or say a review by the occupational health therapists. Your answer will just not be enough, and you will not get all the points for management, and you may not pass the exam. The idea is to acquaint yourself with how things work inside an NHS hospital, because those are the standards they expect you to know. While the fourth point is to remember that in any given PACES station, your examiner is not a specialist in the specialty of the station. For example, in a respiratory station, you will not get a respiratory consultant as an examiner. You will get, for example, an endocrinologist or a rheumatologist. Therefore, do not forget, the examiner is not a specialist. The examiner is not a specialist. The examiner is not a specialist. And why this is important? It is because it tells you really needed to know as much as a general medical doctor would know about any given problem, because even the examiner does not know all the details about that problem that you've got in your station. Number 5, learn how to study for an exam. Studying for an exam is different from studying to learn. Studying for an exam, it means to study those things that can be turned into questions, or they can be demonstrated on a case. They are signs, they are symptoms. Do not waste your time for a clinical examination to memorize pages, sheets and books of theory. That will be waste of precious time that you don't have. You need to perfect your routine when you perform a physical examination on a patient. That is more important. That's what's going to give you the points that you need to have a high score and pass the test. Number 6, and this may be the most important point we'll mention today, and that's confidence. Confidence is something very important in a clinical examination setting. This was important since you were a medical student passing your MBChB or MBBS exam. Why confidence is important and how much confidence is needed for the exam. Now, too much confidence is not a good idea, because if the examiner feels you are overconfident making decisions, that means you will become an unsafe doctor, because overconfident doctors will not be meticulous. They will not go through things once, twice to make sure they've got it right. They will do whatever comes to them first time, and that is not good, because we all make mistakes. Now, the opposite of this is not to have enough confidence, and that's no good either, because you're being tested to become a medical registrar. You have to demonstrate that you will become an efficient decision maker, that you will be decisive, that you have confidence in your abilities and your knowledge. The last point, which is also point number 7, is not to panic if you make a mistake, because that's okay. That's part of being a human. That's part of being a doctor. That's part of the normal diagnostic approach of any doctor, normal diagnostic thinking of any clinician when they approach a case in real life. And that's something the examiners know. As we mentioned in the previous point, in point number 6, don't change your answer too many times. But, for example, if you change the order of your differential diagnosis, that's absolutely fine, because that's something you would do in your real life. For example, you'd say, the patient probably has bronchiectasis. Actually, taking that sign into consideration, maybe COPD. COPD is more likely. With that, we conclude our first video. Remember these golden 7 points to perform better in the PACES exam. Alright guys, I hope you found these tips useful. To get alerted about future videos discussing tips and tricks for the MRCP UK PACES exam, or discussing clinical cases for the MRCP PACES exam, please subscribe to the channel and activate the notification button, and also share the video with your friends so that everyone can benefit. If you have any questions or comments, please leave them below in the comments section, and I'll make sure I'll reply to your comment as soon as I can. Hope to see you soon in our next video.